Well, thank you guys so much for joining us today. We're here at Guiding Right in Oklahoma City and ready to give you guys an update on our fight against COVID-19. I'm joined by Commissioner of Health Gary Cox, State Senator George Young, and the President of Blue Cross Blue Shields, Dr. Joseph Cunningham, and also Dr. Wendelboe from the State Department of Health, our lead state epidemiologist. So Commissioner Cox has some great news to share about our testing and our contact tracing here in Oklahoma. But I wanted to start by giving everybody an update on our PPE. On March 15th, we declared a state of emergency. My top priority was to protect the health and lives of Oklahomans. We immediately went to work securing protective equipment, test kits, and other medical supplies to be able to protect Oklahomans. As part of our response, we have shipped PPE to all 150 hospitals. We just completed shipping a 7-day supply to all of our 308 nursing homes all across the state, as well as EMTs, law enforcement, firefighters, funeral home employees, and many others on the front lines fighting COVID-19 across the state. Congress passed emergency funding, so we're so thankful for our federal delegation for passing that for our state. We roughly have $1.2 billion now in our state to help fight COVID-related expenses and to provide relief for the COVID expenses that we've spent. And every dollar we spend fighting this virus is 100% reimbursable from the feds. My Secretary of Budget, I set him up and he immediately got to work to form a special financing team of public employees to monitor and maximize every penny, and they have done an outstanding job. These federal dollars have allowed us to purchase millions of N95, KN95 masks, and surgical masks in a very competitive global market. We've been able to buy gowns, face shields, hand sanitizers from Oklahoma businesses. I'm so proud of the Oklahoma businesses that have taken their manufacturing and have changed very quickly. Companies like Covercraft in Pauls Valley, Prairie Wolf in Guthrie, Professional Imaging Packaging in Tulsa, Oklahoma Folding Carton in Minco, and Lucas Color Guard in Oklahoma City. We will continue to use these federal funds to ensure they have access to critical protective equipment while this global supply chain continues to be disrupted and until it gets restabilized. I'm going to continue to turn over every rock and run down every lead as we compete against other states and other countries around the world for PPE. Because my job as governor is to protect the health and lives of Oklahomans first and foremost. When questions arose this week about the amount of spending taking place at the State Department of Health, the team pulled together a quick overview of our current expenses. Here's a quick rundown of what has taken place in the last 6 weeks. The State Department of Health, that is the agency that is buying the PPE, the ventilators, the testing supplies, and all the other medical equipment that we're using to protect our health workers. With everything the health department has bought to protect Oklahomans, it's spent 1% of our total federal dollars available to fight COVID up to this point. Everything we're buying is to protect the health and lives of Oklahomans. That's been my goal from the beginning, and that includes making sure that all of our healthcare workers, our first responders, have the PPE that they need. As I've said before, coronavirus is still in the United States. It's still in Oklahoma. As we continue to safely reopen our state, we need to keep our guard up. Now is not the time to just go back to normal. We need to continue to practice social distancing, continue to wash our hands, stay home if we're feeling sick, and we need to also focus on protecting our most vulnerable population. Part of the reason we're here today is because we continue to expand testing. As we test more people, we will still find new cases in Oklahoma, but I want you to hear me. Our infection rate is going down. Of all the people we've tested, just 5.67% are coming back with a positive test. That means for every 1,000 that we're testing, 943 come back negative, and just 57 are come back positive. At the beginning of April, we had over 10% of our tests come back positive. So that is a great sign that we are continuing to have a lower percentage come back positive. With more testing and expanding our contact tracing, we will be able to continue to slow the spread of this virus and keep Oklahomans safe. Oklahomans have done a fantastic job, and I said it in the beginning, the better job we do in early April, meant we're going to be able to get back to work quicker in May, and Oklahomans have really sacrificed and done a great job, and it is time to start a measured reopening. I'd like to turn it over to Commissioner of Health Gary Cox to tell you a little bit more about the testing and the contact tracing. Commissioner Cox.
Thank you, Governor. As Governor Stitt begins the phase 1 of the reopening of our state tomorrow, the State Health Department remains vigilant. But before I begin, I want to take a moment to recognize the hard work of the public health workforce. These are our nurses, our nurse practitioners, our laboratory folks, our folks that work the swab drive-thrus, our support staff. They have worked tirelessly on protecting the lives of Oklahomans. And they are actually the tip of the spear in this response. So they're working around the clock. Many of them are working 16 hours a day, 7 days a week, and they're going now, many of them have worked straight for 60 straight days. So we appreciate the time that they have taken away from their families and their lives to really protect the lives of Oklahomans. So our agency has posted guidance documents on our coronas.health.gov site on how each industry can contribute towards our efforts to keep their employees and customers safe. The governor mentioned tracing and testing, and these efforts are absolutely essential to our success in reopening the state of Oklahoma. Governor Stitt has called for all COVID-19 testing locations to expand across the state to give access to all Oklahomans, even those with no symptoms. So this is critically important because our public health and our partners are prepared to handle the response and to handle this increase. Over the last 8 weeks, the State Health Department has led opening of 80 drive-through testing locations, and this in many cases has doubled week by week to increase the state's testing capacity, which is critical. To make it short, we've come a long way in a short period of time, these last 8 weeks. And I say that I credit these successes to the thousands of public employees who are working around the clock, to our university partners of OU and OSU, to the legislature for granting the catastrophic emergency declaration that's allowed us to streamline state and county operations to be more able to quickly respond to this situation and the pandemic that we're in. In May, our goal will be to test over 2% of Oklahomans, of Oklahoma population. This would mean by the end of that May, we will have collected and processed 90,000 tests covering 2% of our population. The state's current plan is to provide testing to all nursing homes residents across the state. So we urge the public to go through our drive-through locations and other locations and get tested. Your participation will allow us to expand our knowledge on what is the level of the community spread and what are the number of folks that are asymptomatic or presenting without symptoms. So that's testing. Contact tracing is equally important. And so testing and contact tracing go hand in hand in our efforts to really slow the spread and minimize the spread of COVID, while at the same time safely opening our economy here in Oklahoma. These critical efforts will identify people who have been exposed and don't know it. As the governor mentioned, the virus is still here. It hasn't gone anywhere. And the State Department of Health is committed to work with all Oklahomans as we safely reopen our state, and to continue to monitor and share the critical data for decision making. While we continue to respond to positive cases with aggressive mitigation strategies, we also understand that each community is unique. The response will vary based on the level of community transmission, the characteristics of each community, and their populations. And so, as part of our governor's reopening plan, we've been strategically building out our contact capabilities in a phased approach. At this time, we have over 150 of our state health department staff who are turning around in investigations for our current workload of positive COVID-19 cases. Over the next month, we'll be expanding this team to an additional 500 tracers in partnership with the National Guard, with OU and OSU, and we'll train another 150 that are currently being trained and be able to double our capacity as early as next week. Our goal is to have at least 1,000 contact tracers ready to deploy as needed. We'll achieve our public health goals in a fiscally responsible way by leveraging available resources and the funds provided by Congress specifically for combating COVID in Oklahoma. I'd like to, in just a minute, introduce you to Senator George Young, who's always been a great public health advocate in our state, and he's here to announce the second part of our testing plan to help us meet our goal of an additional 90,000 COVID-19 tests during the month of May. As Commissioner, I've been focused on expanding the agency's public-private partnerships, and I'm excited about the one we're announcing today, and I appreciate Senator Young's partnership in making this possible. The State Health Department and Blue Cross Blue Shield of Oklahoma have had a long-standing partnership through the Oklahoma Caring Foundation to operate the 9 caring van program throughout rural Oklahoma. Outreach through the caring van mobile health partnerships allow us to be innovative in our approach to public health, take the services to where people are. Today, the State Health Department, the Oklahoma City County Health Department, the Tulsa Health Department are launching a furtherance of this partnership with Blue Cross Blue Shield of Oklahoma that involves caring vans, deploying caring vans in underserved communities for COVID-19 testing access. We don't want anyone to be denied the opportunity to have a COVID-19 test because of transportation issues. And so, Senator Young, would you like to share a few words with us now?
Thank you, Commissioner Cox. It is a pleasure and an honor to be here with you today. Let me first bring you greetings from Senate District 48 and welcome to Senate District 48. I like to say it's the heart of Oklahoma City and the heart of Oklahoma. Fact of the matter, the capital is in Senate District 48. I don't get much credit for that. And the governor just reminded me that the governor's mansion is in Senate District 48, and he is my constituent. So I'm glad that he's here also. Let me quickly say that what brought us to this point and to this moment is the relationship that I have with Commissioner Cox. When he was at City County Health Department, we worked together then on many different issues. And when the COVID-19 struck and when it became prevalent here all over our country, one of the things that I became overly concerned about was the fact that I saw in many cities what I didn't want to see in Oklahoma City, and that is in certain communities that they would go and have so much of an outbreak that it would be overwhelming. And so we have not had that, thank God, here in Oklahoma City, but we don't want to have that either. And so when I called Commissioner Cox and said to him, first, I need some statistics on race and COVID-19. He quickly got those to me. And then when I called him back and said, thank you for that, I said, I wonder, I'm kind of concerned about the fact that are we testing enough in certain areas to determine the rate of infection in those areas? And he said, I don't know, but I tell you what, I will see what I can do. And then a couple of weeks later, he called me and said, I've got some news for you. And that's where I want to step in and say thank you to Blue Cross and Blue Shield. I go back to Dr. Rodney and to Ted and all of those leaders and now the new leader who have come and shown that they appreciate and care about the whole state of Oklahoma. And so I'm thankful. And when Dr. Cox said that Blue Cross and Blue Shield had so kindly donated some and given us access to some vans that we could do some mobile testing, he asked me, well, where do you think we could kick this off? And for full disclosure, you're at Guiding Right. The executive director is Theo Noel. And for full disclosure, I am a board member, and I have seen the work that Guiding Right has done, HIV/AIDS work, and then health work for the African American community. I could think of no better place to kick it off than here in the heart of Senate District 48 and in the heart of Oklahoma City, to have access by the people who live here and for us to get a better idea. What hurts us is what we don't know. And that's why I'm thankful that we have now access to get testing to people and to place these vans strategically across Senate District 48 and other areas of our state, rural areas, Governor, that may not have access, so that we might be able to get a hold of this thing before it gets carried away. I see the numbers. I report on the numbers every day, and people are still dying. 5 to 10 people every day are still dying. I'm glad that it has not gone larger than that. But if that 5 or 10th person is your mother, your father, your sister, your brother, your wife, your husband, your son, your daughter, your auntie, your niece, your uncle, your cousin, then it's important and significant. And so that's why I'm excited about what's happening here today. We are putting some attention where I want some attention, I think is needed some attention, so that we might continue to be able to control and have access and to be able to know what's going on in our state with this COVID-19. And so I am very thankful, Governor, for you being here and hearing and listening and being Senate District 48, other than just the Capitol and your mansion, to come out and to see the other parts and to see what's going on. We're going to place these vans in strategic locations. I'll be meeting with other leaders in Oklahoma City, finding out where they believe the best places are so that we can have them there periodically to do the testing and to give all people access. We have a problem with health disparities all over America, and that disparity is existence in Oklahoma City. But when we have responses like this from our Commissioner of Health and from Blue Cross and Blue Shield, I think we can make a dent in those disparities, but we've got to keep pushing. So again, thank each and every one of you for coming. Thank you again, both of you. Thank you, Governor, for the work that you're doing to help us to overcome all of this.
Thank you, Senator Young. It's such an honor to be with you here in your district, and I want to thank you for your help in getting this set up and helping us fight and keep working to fight COVID here in our state and in your district. As Commissioner Cox mentioned earlier, public-private partnerships are so important for our state. Vice President Pence, he spoke about this is not just a whole of government, this is a whole of America approach. And I am so proud of companies like Blue Cross Blue Shield that are helping us and answering the call to the whole of Oklahoma's response. And so I'd like to invite Dr. Joseph Cunningham to say a few words. Dr. Cunningham?
Well, thank you, Governor, and thank you for the opportunity to speak to all of you and to speak to Oklahomans. I can tell you as a physician, I took an oath to protect and take care of all people, regardless of the race, regardless of their income, regardless of where they live. And so this is important. I can tell you and assure you that Blue Cross Blue Shield of Oklahoma knew that we needed to do something in this effort. We also knew that it's critical for us to perform more tests to have a better handle on this extremely contagious infection. And we've had a long-standing partnership with the State Department of Health, the Oklahoma City County Department of Health, and the Tulsa City County Department of Health through our Caring Foundation. And we do that, and we use these vans to immunize children across our state. Well, currently kids aren't in schools. We're practicing social distancing. So we have mobile capabilities and mobile expertise. And so when I had the call with my friend Commissioner Cox, I said, we've got to do something together. We found it was a match made in heaven. He had tests, we had mobile capabilities, and now we're able to help communities across our state. And for that, I want to thank the governor, I want to thank the Commissioner of Health, and the city county health departments in Tulsa and Oklahoma City. And with that, everybody, that we'll bring the test to you, and you don't have to come to the test. So thank you, Governor.
Thank you so much, Dr. Cunningham. We really appreciate the partnership with Blue Cross Blue Shields. I also want to thank the National Guard and the U.S. Air Force for the flyovers that they're doing to salute our healthcare workers, our first responders, our transportation drivers, our grocery store workers, and all other essential personnel. This week, they're calling it Operation America Strong. The National Guard just finished one in the Tulsa area. A squadron from Altus and Vance Air Force bases flew over hospitals, and tomorrow morning they'll be flying over hospitals in Oklahoma City, Enid, Altus, and the Lawton areas tomorrow morning. So I want to close with this. Oklahomans, we are going to get through this. But remember, this is a measured reopening. We're not flipping on the light switch tomorrow. We're not going back to normal. We're going to do a measured reopening, and it'll be phase one. We are going to be reopening our state safely and responsibly, and in a measured approach that is based on the data. If we want to continue to move to phase two, we must continue to keep up our guard. Practice social distancing, wash your hands frequently, and stay home if you're feeling sick. So thanks for joining us today. God bless you. God bless the great state of Oklahoma, and we'll open it up for a few questions.
This Senate district's demographics kind of mirror North Tulsa. Is the same effort going to happen up there?
You want to answer that? Yes, it is. They've got 9 of these Blue Cross Blue Shield mobile testing sites, so they'll be placing them around the state, and North Tulsa is part of the plan. And remember, there's also 80 test sites all across the state of Oklahoma. You can always call 211 to find the closest testing facility. You don't need a doctor's note. We encourage anybody with symptoms. We encourage anybody that just wants to get tested at this point. We have plenty of testing in our state. Certainly, if you've been exposed to someone with COVID, we want you to get tested. It helps with our tracing. It helps with everything. So please go do it. We've tested over 65,000 Oklahomans at this point. We want to continue that method. That's really helping us with this fight.
Governor, on unemployment, the other day you said basically, give me a week. We are working on unemployment. So many people have been calling us saying they're waiting for those level 2 calls. It's been 3, 4, 5, 6 weeks. Do you have a better timeline now of when people might expect PUA to start being paid out to folks?
Yeah, we just pulled 100 employees in to focus specifically on the PUA claims. PUA claims are the contract employees. So we've got 100 folks working on that. I just on the way over here called to get a briefing and an update on that. So we are working through those PUA claims. It's a problem. It's a new system that we had to stand up. We expect half of our 325,000 claims to be out at the end of this week.
And by be out, be out, do you mean paid by be out?
Correct.
Okay.
Health Commissioner Cox, I do have one question for you, if that's all right. I just respond on the audit that was announced, that was kind of called for by the Attorney General's office. I was wondering if you could describe the status of that and how that might affect any daily operations.
The status, yes. Well, we received a notice of the audit. We welcome the audit, and we've had a conversation with Auditor Cindy Bird, and told her to expect our full cooperation. We're transparent, and we open all of our records for scrutiny from her office, and we'll cooperate 100%.
And one thing I also wanted to ask was about the state's purchase of hydroxychloroquine. Is there any plan to use that? I know that Dr. Fauci mentioned yesterday in the White House that remdesivir is a new drug that's being looked at for possible treatment. But what is the plan for hydroxychloroquine in Oklahoma?
Well, I'm not sure what the latest plan is for that. Of course, they're undergoing, it's got a promising practice, at least when the purchase was made, and is undergoing some clinical trials currently, and hopefully those will go well. And what the use of that, it's already a legal drug for physicians to use currently, so physicians can use it now. I think it's recommended more for hospital use. Under a physician's supervision, so it's available for use.
Will the carrying van be using the saliva testing or the nasal swabs? And Governor, I don't know if you have an answer to this, but I know they're starting the saliva testing at nursing homes. Do you know what they're using to like cap and seal those chests right now?
The saliva testing, and this is really exciting for Oklahomans. We're one of 2 states that has validated that testing, and we had Elizabeth Pollard, I think, with our press conference on Tuesday, kind of talking about that. We're going to be using that saliva test across all of our nursing homes to get all 17,500 tested. That's part of what we do. We acquire those cups. So we've already done that. They've already got 20,000 shipments in. That's part of what we do within the health department to protect the health and lives of Oklahomans and to buy testing materials. So we've already bought. It's 20,000 of the cups that they collect the saliva in. And then you had another question. Did you have another question too?
I did. Just the carrying van would be using those tests as well, or if it would just be the nasal swabs.
Doctor?
We're going to use the test that Commissioner Cox gives us to use, and we hope we put pressure on him because we want to do lots of tests.
Yeah. So right now we'll be giving them the swabs, but we'll transition very quickly to swabs or the saliva test.
Earlier this week, we talked about hydroxychloroquine. Are you making as an aggressive push to stock up on remdesivir? Do we even have the money to make such an aggressive push for that drug now?
You know, I haven't talked to my health professionals about that, but I'm going to do whatever it takes to protect the health and lives of Oklahomans. And early on, it was hydroxychloroquine. And if there's another drug that's going to be proven to be positive for Oklahomans, I'm going to go acquire it. I'm going to turn over every rock, and we're going to do that. We've got $1.2 billion that's already hit our state, and the president explicitly told me, you do whatever it takes to protect the health and lives of Oklahomans. That's exactly my intent. So we're scouring the world for PPE. We're competing against other states, and I'll go out and I'll get every drug that I think is going to be is going to help protect Oklahoma's lives.
One question, and then I'll leave you alone for the day. We are seeing in national media stories about your administration wanting to possibly pull the plug on unemployment benefits early. Can you address, are you looking at that? Are you applying for a waiver, or is that just scare tactics? What's going on there?
Well, first off, we want Oklahomans to get these employment benefits for sure, but unemployment is a limited amount of funds, and the idea of unemployment is to bridge the gap between one job to another job. And so that's why I've asked all of our employers to be sensitive to work out other opportunities for employees that maybe in our most vulnerable population, that they can stay and work from home. But when you do get offered a job, part of our standards are the unemployment is there until you get re-offered a job. So it's a balancing act as we're trying to get those funds out the door. We obviously want them back working in the workforce as quickly as possible, but we won't be heavy-handed, and we'll balance that with public safety. And if anybody feels concerned about going back to work, we'll have to work through those issues.
So the reports of you all applying for some kind of waiver are false?
Yeah, I'm not familiar with any waiver. There's $600 that came from the feds. That only lasts through July 30th. and it was an addition to whatever we already had in our own corpus here in Oklahoma to provide up to a $500 a week benefit. This $600 was an addition to that. It ends earlier than our $500 a month unemployment ends, but it all is predicated. The rules are it is really a bridge between one job to another job to have folks. So we want folks back in the workforce as quickly as possible. There's no doubt about that.
Governor, you get asked all sorts of weird questions. I suppose that's part of the job. You mentioned first responders and those on the front lines being critical to the effort to fight COVID-19. There's been some talk and some reports and some debate over whether those who are exposed to COVID-19 while working, EMTs, et cetera, if they contract COVID-19 and have costs associated with that and can't work, is that, in your opinion, should that qualify as a workers' compensation matter?
You know, we signed an executive order to any state employee, any first responder that contacted COVID during their work, they would have 14 days of paid time off. As far as a workers' comp claim, haven't thought about that. I would need to go back and look at the statutes to determine what that would look like.
I appreciate it. I think the legislature wants to. Dr. Cunningham, if I could ask you the same situation. You know, you're the CEO of an organization that I believe is going to be staffing this caring van, and if one of your employees were to get, COVID-19, would you expect there to be a workers' comp matter as a result of that?
Well, I can't be sure if it was a workers' comp issue, but I can tell you that we intend to take care of our employees that put themselves voluntarily at risk to help others. And that's not to imply we're not going to take care of all of our employees, but we will go the extra mile for those that are trying to help others.
Thank you.
Commissioner Cox, I think this one would be for you. Going back to the audit on the State Department of Health, obviously you said you welcome the audit. Do you see any reason to change? You know, an audit can take potentially months. It could take a while. Do you see any reason to change current procurement processes in the meantime while you wait for the results of the audit?
Well, there's a full-time person who is, as the governor said, is every day, long hours of each day, tracking down and overturning every rock to find all of the PPE and other materials it takes to respond. And our primary mission and our primary goal is to save lives in Oklahoma. And that's we want to do that in a fiscally responsible way. But at the end of the day, we want to save lives and we want to maintain health of Oklahomans. And so that's our primary goal.
Governor, I had a question specifically for you on the $1.2 billion in CARES Act funding. I'm curious if you see any need to, get input from the legislature on how that money is expended. My understanding is you don't have to necessarily.
Yeah, we're setting up a whole team that administers those dollars. So some of those dollars are for municipalities and cities to replace COVID-related expenses there. So we're standing up a process for them to send in their expense reports and their grant applications, so to speak, of what they've spent to save lives in their community. And then then we'll funnel the money to those cities and municipalities. Then the other piece of monies that came from the federal government is through state budgets. And so we've instructed all of our different CFOs, chief financial officers throughout state government, to classify everything that's COVID related, whether it's overtime, whether it's computers to work from home, or the example we just gave here with the State Department of Health, acquiring PPE. So we classify everything COVID related. That will all be 100% reimbursed, whether it's in whatever agency across state government. And we're going to set up a team of folks from rural Oklahoma, folks from urban Oklahoma, all over to figure out how to get those out. But basically, it's going to be pretty simple. It's going to be COVID-related expenses will be reimbursed from the federal government.
Commissioner Cox, in the early days here, other states complained that they not only found themselves competing against other states, but they also found themselves bidding against FEMA as well. Was that Oklahoma's experience when you were out there trying to find PPE anywhere, scouring around trying to find drugs, equipment, all that kind of thing? Did you find yourself competing with FEMA also?
Well, in the early days, there was a shortage of both testing supplies, both of reagents and of swabs, things of that nature. It's still a challenge, but it's beginning to open up now. There was a shortage of PPE, particularly N95 mask in the Strategic National Stockpile. And in essence, every state was competing against each other's state. And there was more or less a federal bridge that was put into place. And so there was some, I'd say, some reapportionment of some of those shipments to the states and to the cities, for example, New York City, who had the larger outbreaks. And so that's been a challenge, and we think now that that pipeline is beginning to open up more. We know it's going to open up more on the testing because we were just on a call last evening with the White House and CDC, and they promised that we will have our request of 90,000, the ability to do the materials to do 90,000 new tests. It'll be made on weekly shipments each week in May, and then hopefully in June we'll see how that goes, but they made a commitment for June as well. So I think there's a light at the end of the tunnel, but it's been very challenging, but it's been approached in an aggressive way because we're here to protect the lives of Oklahomans.
Sir, did FEMA ever actually get in the way of any shipments coming to Oklahoma? Did you find yourself bidding against them? Did they divert any kind of equipment or any kind of supplies coming to Oklahoma?
Not that I'm aware of.
Thank you all. Thank you guys for taking questions. Governor Stitt, I do have one last one for you. I know we've heard from a number of cities and local police departments and fire departments that are expecting to have to make budget cuts because of the recent decline in sales tax revenue that's come as a result of all this. Do you think it's time to look at property tax or other revenue forms of revenue that cities could use in the future that are not possible at the moment?
You know, we have not thought about any of that, and no, it's not time to raise taxes on Oklahomans. You know, we think we can be fiscally responsible. Thank goodness that we saved $200 million last year. We have the largest savings account in state history. We're going to deliver core services, but we can do it in an efficient manner. We can be innovative as we have to tighten our belt, as Oklahomans are having to tighten their belt right now. You know, the cities and municipalities, we're going to be able to recover any COVID-related expense, but it was in the CARES Act. Now, I know we're getting into the weeds a little bit, but the CARES Act specifically said it was not for revenue replacements. And so we won't be able to use that money for revenue replacements, but anything COVID related, purchasing PPE, equipment, all the testing supplies, all the things that we're doing, we're going to be 100% reimbursable.
Governor, real quick, just to follow up on that. You said it's not the time to raise taxes. If we get in the weeds on the legislature, I believe House Bill 1992 would simply allow municipalities to have an option to hold their own vote on getting some millage from property taxes. Is something like that possible in your mind this legislative session, or do you think that's too deep in the weeds for now?
Well, you know, the legislature, I think they're going to be back next week. They've got a limited time. You know, we have to be done by May 31st. It's something that I don't know if the legislature will take up or not with the limited amount of time that they have. But again, it's not the time to raise taxes. We're going to have to be smart. We're going to have to be innovative. That's why I'm rolling up my sleeves, digging into the details, and we can use technology. This is a great practice run. We've got 30,000 employees working from home across state government. We think we can innovate and we can deliver services through technology, and we can be very efficient and do that, and get more efficient in the way that we deliver services to Oklahoma. Thank you so much for allowing us to be here with you guys today and answering your questions.
Thanks, everybody.